Hey guys, this is Dr. Daniel Sugai, board certified dermatologist in the Seattle area. I'm excited to talk to you about cosmetics for once. We were not doing much of this or at all during this pandemic. I really miss doing it because these procedures are great. They're low risk, high satisfaction rate. They do Botox and fillers quite a bit. So today's video will be talking about the differences between Botox and fillers. So you hear about people saying, oh, you got Botox in your lips, or oh, she got filler in her forehead. Those types of things are incorrect. So we don't usually put Botox into the lip itself. We do put it around the lips for wrinkles from pursing your lips. Going into the lips, it does not augment lips. So we'll be talking about different types of wrinkles. So let's break down wrinkles. Wrinkles, or the term rhytides, it can be broken into two categories: static wrinkles or dynamic wrinkles. Static wrinkles are present at rest. So when we are not moving our facial muscles, the wrinkles that show up would be deep creases around the mouth, the marionette lines. Also, we talked a little bit about smoker's lines, or the wrinkles around the mouth at rest or during pursing your lips. So pursing your lips, causing those deep creases around your mouth, those are dynamic wrinkles, whereas the smoker lines that are just there at rest or with age or sun damage can cause those to be static. So those are static wrinkles. Dynamic wrinkles you see with facial movement. So when I make a frown and I pull the corrugator muscles there, it will pull my muscles in and make 11. So one of my favorite actors of all time, Leonardo DiCaprio, great actor, very expressive, really knows how to use his corrugators. He's had really deep furrows in that area, whereas if he had Botox, he may not have won that Oscar, but he would have a smoother area and not pull his corrugators as hard, because if you pull your corrugators over time, it will leave deep furrows there permanently, and they become from dynamic wrinkles to static wrinkles, where at rest, you're gonna start seeing those 11s we talk about. You do a surprise face, as you can see here, I have these forehead or frontalis muscles moving. Those will cause wrinkles there. Just like you were to fold a piece of paper over time, it would leave a crease. And that crease can be permanent or stay there as a static wrinkle and not just show up with facial movement. The other area that's very common would be the crow's feet. So as you smile, you have these lines that come up there. Those are crow's feet. And that is a very nice area for Botox, because it can really knock out the muscle, the facial muscle that's pulling with smiling. It pulls the skin inwards and causes these creases. So by putting Botox there, we can soften those wrinkles. Botulinum toxin is derived from a microorganism called Clostridium. There are different types. There's type A, type B. Type A, we think about Botox, or the new Botox, it's called Jeaveau, or Neurotoxins, that just came out recently. I have yet to try that, but Botox is my favorite. The other things you might hear about, Dysport, Xeomin. Xeomin has no complex proteins in it, so you cannot get an allergy to that, so that's the advantage to Xeomin. In my residency training, I'm probably most comfortable with using Botox from Allergan, so would donate free product for us to practice on each other, family members, friends. So that was a nice perk of being a dermatology resident. But also MERS would give us samples of filler like rhytides or even Xeomin, which is great. The neurotoxin, it sounds scary, it's a toxin, you think of poison. Those are meant to freeze or to halt the movement of your facial muscles wherever you put them. It's only temporary, it doesn't go systemically. You know, you think of tetanus shots for Clostridium bacteria. This is different from that. So this is a completely safe medication that we do use. And there's also other purposes for it, like put it in the bladder for any bladder spasticity. So neurologists will use it for migraine headaches. It also helps with shutting down the sweat glands. So people with hyperhidrosis or excess sweating, you can put it in the armpits or the palms to help with bothersome sweating that you're very self-conscious about. So getting Botox, you're gonna be freezing that muscle, so you're not using that muscle. And over time, if you don't use that muscle, this will flatten out and soften, and then you don't have that crease. And that's the hope for it. If you don't have that crease yet, you're preventing you from getting that crease down the road. we put Botox. Botox is very versatile. Other places you could put it would be the masseters. So a lot of women don't like that angulated jawline, which can be considered masculine. So to soften that, you can put Botox to atrophy or shrink the masseter muscle here that's used for chewing. And then also you can put it around the mouth for those smoker lines or lines that come up with pursing your lips for different expressions. The only thing is afterwards you'll have trouble whistling or drinking out of a straw. The other areas you could put Botox would be the platysmal bands in the neck with certain expressions, the whole muscle bands that come up. So some people have very prominent bands. You can put a few injections of Botox there to soften that. But you want to go to someone experienced. So does Botox hurt? Just little pricks across the forehead or around the eyes. It does not hurt. Men get this done, and trust me, everyone out there, men, we're not the toughest, so if men can handle it, I can handle it, I promise you guys can handle it too. Typical numbing is not required, so we just go for it. The 10-minute appointment, we have you sit down upright, we clean the area and put these injections. I always say for the first 15 minutes, it can look like red little mosquito bites across the areas where we injected, but they do go down quite quickly. You could get some bruising though, especially around the areas of your crow's feet, because that's very thin skin, and also we put very superficial injections that cause these whelps along the side, and sometimes you can nick a small little vessel and cause a little bit of bruising. But not to worry, you can use arnica, over-the-counter cream to help with the bruising. Makeup can cover it for sure, and just expect a week of bruising. Don't want to lie down within 4 to 5 hours after your injection because we don't want to move the product around. But otherwise, yeah, it's a very simple procedure. Of course, you don't want to get this done while you're pregnant. So moving on from Botox to fillers. Fillers are great because it's addressing different areas of the face from Botox. We don't have much of an overlap except for maybe around the mouth. As we age, go from having a upside down triangle orientation to our face to a upright triangle, which happens from skin sagging down, right? Not just with gravity, but also because we're having resorption of the bone. As we get older, our bone resorbs and shrinks, and thus has less structure to hold up the curtain. As the bone shrinks back, the curtain will fall and cause this jowly look down in the jawline. It will become very heavy around the nose, and that's where people really get bothered by this nasolabial, melolabial fold, causing drooping at the corners. And then people say, I always look angry. People ask, why are you so mad? Your lips are going down. You just don't look like a happy person. So, Botox is nice for up here because it makes you feel lifted, especially if you're doing the glabellar complex. You can do an eyebrow lift, but also here we want to do a little bit of a lift as well with fillers. So different types of fillers out there. I primarily use a hyaluronic acid filler, where I mentioned hyaluronic acid quite a bit in my other videos about moisturizers and cleansers, because hyaluronic acid is a naturally found carbohydrate in our skin that soaks up water like a sponge. When you have a filler, you have instantaneous results. It's great. Instant gratification. Isn't that great to have in life? But anyways, you have swelling after your procedure because you're drawing in all that water, and the swelling will diminish over the next 3 to 5 days. Sometimes it takes a whole week. But a lot of times people don't mind that swelling, especially when you do lip filler, because you have this really puckered, puffy lip look. But as it goes down, you almost miss that look because you like that augmentation there. But the swelling, you can use ice after your procedure. But that's the whole point of hyaluronic acid, is just draw in water. And its benefits can last between 4 to 6 months. And the newer products like Volure, Volbella, Voluma, those can last up to a year, which is really nice. The other ingredient that you might see, I have rhytides here. This is calcium hydroxyapatite microspheres, and these are suspended in a water-soluble gel. And rhytides is a nice product because it's not hyaluronic acid, but this calcium hydroxyapatite, which is found in your bones, your dentition or teeth. You can use this to rebuild that bone we talked about that gets resorbed with aging. So when you rebuild the cheekbone or filling in sunken, we have a sunken cheek look for people who are runners or patients with HIV and they have fat atrophy in the cheeks, you can augment the mid-face and restructure it and contour it however you like. The other nice thing about calcium hydroxyapatite is that it does stimulate underlying collagen regrowth or production. So great things. It mimics new bone and also brings in new collagen. And this can last between 1 to 2 years. I don't use this in my practice. I did this in residency quite a bit, but right now I only stick with the hyaluronic acid products. But I just want to show you quickly what the differences are between the two. So this is Juvederm Ultra Plus, which is really nice for mid-face augmentation, and this is the Rhytides, which has lidocaine. They both have lidocaine mixed in already, which is very convenient because the more you're injecting in an area, the less pain you'll be feeling. Juvederm Ultra Plus, hyaluronic acid. This is the sugar we talked about. I'm going to do a demonstration too, just showing how each product soaks up water very differently. So as you can see here, this is a thicker hyaluronic acid based filler. I don't put this into the lips, but I do like to put this around the cheekbone. For the nasolabial folds, you can use this, but you see how that just rubs in very differently from the calcium hydroxyapatite here. These are expired fillers, much thicker, right? So this is what's in bone, your teeth. They draw on water very differently. So for fillers, we're addressing static wrinkles and also sagginess. So we can put Volbella around the mouth. We can help upturn the corners of the mouth, or we call the oral commissures. And we can also help with the static wrinkles around the lips, the smoker's lines, the lines that you get from age, from chronic sipping out of a straw, sun damage. Those things will promote wrinkles around the mouth. And so you can soften those quite a bit with something like Volbella or Juvederm Ultra. Those are really nice. You can also do around the mouth or around the nose and the nasolabial, melolabial, or the marionette lines there. You can use a thicker product like Velour. Juvederm Ultra is nice. And then as you go up towards the cheekbone area, the temples, you can go for something thicker like Voluma or Juvederm Ultra Plus. And those are the things we do in my practice quite a bit. Other uses you could do is you could fill in sunken hands. So people who don't like how their hands show their age, you could fill in a thicker filler into those areas to plump that up. Another question would be, does filler hurt? Well, filler can be painful a little bit more than, or let's not say little, quite a bit more than Botox, but I don't want that to discourage you. But just to be real with you, it can be painful. So we do say before your appointment, come in 15 to 20 minutes early so we can apply numbing medicine onto the area you want treated and let it sit there so that it can dull the painful sensation you can get from the injections, especially before the lidocaine kicks in. The lidocaine, like we mentioned, is mixed in with the filler, but just to help with the initial start of the treatment, we do use ice, we do use numbing topical creams. That does take the pain off. The lips are very sensitive, but I've done it on men and women who say they have a low pain threshold and they do fine. Women who have high pain threshold, they do excellent. Okay, we have some expired Juvederm Ultra Plus, hyaluronic acid, and some lidocaine. No plumping whatsoever, whereas the hyaluronic acid filler here really started to expand and draw in water immediately, whereas the calcium hydroxyapatite did not draw in water. Though these microspheres of calcium hydroxyapatite are already suspended in a water gel, this does not draw in water like the hyaluronic acid filler. It's a really quick comparison between Botox and fillers. I hope you consider doing them down the road if you want, no pressure. But if you're ever interested, see a dermatologist who's experienced. Be careful, really look into who you're going to, do your research because it is your face, it is your hard-earned money. And I'm gonna do another video on what to expect for a Botox visit or a filler visit. All right, so take care everyone. I got all this filler on my hand I'll have to wash off. But anyways, take care guys and see you for the next video.